Welcome to The Explainer. Let's just jump right in, because today's topic is absolutely fascinating. We usually think of the eye simply as a camera, just capturing the world around us. But medically speaking, the eye is actually a transparent window into the body's vascular and neurological systems. It is quite literally a biological battlefield, where systemic, full-body immune system collapses are visually revealed in stunning and honestly, sometimes terrifying detail.
And this brings us to a really compelling medical mystery. How exactly does a common, completely silent, symptomless virus, an invisible passenger living inside millions of healthy people, suddenly transform into an aggressive, blinding threat? How does the balance of power shift so dramatically that the very organ giving us sight gets compromised from the inside out? Well, that is exactly what we are going to unpack today.
Here's our roadmap for this explainer. We'll start with classifying posterior uveitis, move on to the ubiquitous CMV threat, then HIV and immunodeficiency, look inside CMV retinitis, and wrap up with other ocular invaders.
All right, Section 1, classifying posterior uveitis.
So when we're looking at posterior uveitis, which is just a fancy way of saying inflammation in the back of the eye, doctors basically split the causes into two main camps. On one side, you've got inflammatory disorders with uncertain origins, things like sarcoidosis or systemic lupus erythematosus. And on the other side, we have our known infectious invaders. These can be bacterial, like syphilis and TB, fungal, like candida, parasitic, like toxoplasmosis, or viral. And that viral group includes HSV, and our main focus for today, CMV. Moving right along to Section 2, the ubiquitous CMV threat.
Take a look at this. These green, spiky, honestly kind of alien-looking spheres, that is Cytomegalovirus, or as we'll call it, CMV. Medically, it's classified as human herpes virus type 5. It really shows off the sheer architectural complexity of what we're dealing with here. It's part of the herpes virus family, but its most defining characteristic is just how shockingly common it is. And that brings us to this staggering statistic. 50%. Half of the entire healthy adult population are seropositive for CMV, meaning they carry the antibodies, they've had it. And in HIV-positive populations, that number skyrockets to literally 95 to 100%. But here's the wild part. For the vast majority of healthy adults, that initial infection just causes some mild mononucleosis-like symptoms, or quite possibly no symptoms at all. It is entirely asymptomatic.
Which brings us to its whole strategy. CMV is basically the ultimate Trojan horse. After that initial infection, the virus doesn't actually leave your body. It just goes latent. It sits there, totally dormant, hiding from your healthy immune system. It only thrives when there's a massive collapse in the host's defenses, what we call immunodeficiency. The virus is just patiently waiting for a moment of extreme vulnerability, which can be triggered by leukemia, immunosuppressing steroid treatments, advanced age, or historically, HIV.
All right, Section 3, HIV and immunodeficiency.
Now, this Konski graph is absolutely fundamental for understanding how opportunistic infections work. On the vertical axis, you've got these two opposing forces. You have the CD4 cell count, think of those as the generals of your immune system, and the viral load of HIV. As time marches on along the bottom axis, you can visually trace the tragedy of untreated HIV. The virus specifically targets and proliferates inside those CD4 lymphocytes, destroying them. So as that green line representing your CD4 cells steadily drops towards zero, the blue line representing the viral load just surges upward into AIDS.
And right at this precise threshold, that's where our dormant CMV finally wakes up. CMV retinitis is a pretty late-stage occurrence in HIV progression. It usually only strikes when the immune system is utterly depleted, specifically when that CD4 count drops dangerously below 100 cells per microliter. To put that in perspective, before highly active antiretroviral therapy was around, about 30% of AIDS patients developed this infection. And historically, it signaled a very short average time to death from the moment it first appeared.
But here's something incredible. The eye actually tries to warn us even before CMV takes hold. It can reveal systemic HIV infection through specific retinal changes, which we call HIV retinopathy. Clinicians are basically looking for microangiopathy and the presence of multiple cotton wool spots on the retina. Crucially, if you see these spots in a patient who isn't in an age group prone to hypertension, it's a massive red flag. It's a visual, early warning sign of a hidden HIV infection that's already compromising the blood vessels.
Which brings us to Section 4. Inside CMV retinitis.
It is a brutal battleground in there. In fact, eye specialists use a supervisceral clinical phrase to describe what they see when looking into an infected eye: ketchup on cottage cheese. I know, sounds a bit intense, but it perfectly captures this devastating visual mix. The cottage cheese represents the multiple yellow and white geographic lesions of retinal necrosis. Literally, the tissue is dying. And the ketchup? That's the associated vasculitis, bringing heavy exudate, sheathing, and severe hemorrhaging right alongside the blood vessels.
Once it's active, the rapid march of CMV retinitis is genuinely terrifying. If it's left untreated, it kicks off with full-thickness retinal necrosis. As that tissue dies and mild vitritis sets in, it spreads, leading to retinal detachment in about 30% of cases. Finally, it culminates in optic atrophy. The ultimate result here is eventual severe vision loss.
And honestly, maybe the most alarming metric of all this is the sheer speed. Inside a compromised eye, CMV retinitis can advance at a rate of 300 microns per week. It just aggressively sweeps across the delicate retinal tissue, permanently destroying the patient's vision millimeter by millimeter.
Moving to our final section, Section 5, Other Ocular Invaders.
See, when the door is left wide open by severe immunodeficiency, CMV is rarely the only thing that gets in. The eye can harbor multiple severe infections all at exactly the same time. A patient might show up with pneumocystis carinii choroiditis, which is linked to systemic pneumonia. They might also be concurrently fighting off bacterial invaders like syphilis, gonorrhea, or TB. Or maybe they have candida, leading to severe fungal chorioretinitis. The eye effectively becomes an open sanctuary for whatever pathogen happens to be circulating in the bloodstream. And it's really fascinating to see how targeted some of these other necrotizing viruses can be. Take acute retinal necrosis, or ARN. It's caused by completely different viral strains depending heavily on the patient's demographic. For instance, herpes simplex virus 1 primarily drives ARN in younger patients. But if you see ARN in an older patient, that's primarily driven by herpes simplex virus 2 and VZV, the varicella zoster virus. Oh, and a quick side note, if a patient has an HSV infection in the front of their eye, they're highly likely to develop ARN in the back of the eye too. Taking it one step further into extreme territory, there's a condition known as PORN, or progressive outer retinal necrosis. This is an incredibly aggressive, just devastating reaction specifically to the varicella zoster virus. It really just hits the nail on the head of how ruthless these opportunistic pathogens can be when they face literally zero immunological resistance. Which leaves us with a pretty incredible perspective, doesn't it? We've seen how a latent virus like CMV can quietly wait for a collapse in our CD4 cells to launch a devastating attack, turning the retina into a visible battlefield. So the question I'll leave you with is this. If the back of the eye so clearly reveals the immune system's most hidden microscopic battles, what other systemic secrets is your vision currently protecting? Thank you so much for joining me on this explainer. Keep learning, keep questioning, and I'll catch you next time.